Vertigo and imbalance. Well, it's one of the most difficult, really, problem. Most of the doctors, generally speaking, the GPs also, they have problem to diagnose and find out if it is really vertigo or not. So vertigo is not just a simple dizziness. It's a very specified type of dizziness. But most important, that the surroundings of each of us, when they have vertigo, it should move while you are staying. But if you have a light-headed or a little bit headache or heaviness in the head, or you cannot stabilize yourself or balance yourself straight when you stand up and feel a little bit not well, these are not vertigo. So this is why it is very much confusing subjects in medicine. The true vertigo, the main causes is an infection of the balance organ, which is very much close to the hearing organ. Again, it is not in the middle ear, it is the balance organ very close to the brain. Second major cause is Meniere disease. The hearing level is getting down, and then spinning and vertigo, very severe, usually ends up with vomitings, and there is a lot of noise inside the ear. Positional vertigo. People, they develop that kind of imbalance in a certain position, or when they change position to another position. And there is, of course, other causes, like if you have exposed to a head trauma, some ear surgery can result also, if it is wrongly done, can result also in some kind of vertigos. So this is what's so-called peripheral vertigo. The causes usually is not in the brain. Then we have what's so-called a central vertigo. Some problem inside the brain. Most well-known problem is something called acoustic neuronoma. It is a benign tumor. It grows up and causing pressure over the hearing nerve and the balance nerve. So we have to find out if we are dealing with the vertigo through a very intensive questionnaire. And secondly, we have our ENT full examination. We have to examine everything. Mainly we have to emphasize on the ear, and then we have what's so-called a vestibular test or vertigo test. And one sophisticated test called electronystagmography test. This is a quite important test. It can detect the very minute problem. Most of the vertigo, we can see that also through the eye movement. The right diagnosis of the problem can guarantee a good and proper management. And management is not all same. Some of the vertigo, we can treat it with medication, different medication. Some of them, not all, some of them with some surgery if it is optioned, but most of them with what's so-called vertigo training program. So again, it's very complicated things, but for that, we are proud that we're having a very specialized unit who are doing only with vertigo and very intensively work out, and then I think we are able to find out the causes and we treat it accordingly.